I'm Philippa Howden-Chapman, and I work at the Department of Public Health at the University of Otago in Wellington. I'm going to be talking about our chapter, Building Inequality, the way society can literally be structured and restructured. But I'd first of all like to pay tribute to people, to Max, a man with many talents, who made the choice to return to Aotearoa and give voice to those who had not. And also to Bridget Williams, a woman of outstanding integrity and commitment, whose publishing company embraced this important book and supported it with Tom's talents. So I have two collaborators in this. I don't know, is Chris here? Pardon? No, he's not. Okay, Sarah Bierre, who's a postdoctoral fellow, and Chris Cunningham, who's a professor at Massey University, where he runs the Māori Development Unit. And in our chapter, we document the history of the government and private companies building housing in Aotearoa, New Zealand, from the days of the first colonial public-private partnership. And it struck us that, in fact, the New Zealand company and the relationship with the Crown was the first public-private community partnership. And through the tentative efforts of the Liberals at the turn of the century, the results you can still see out of Patilni, the major Labour state housing building projects with Fletchers, and haven't they done well, after the Second World War, and then the baton passed to the City Council. I was lucky enough to marry into the family of my husband Rafe with Professor Bob Chapman, and we were bequeathed all his books, and he taught in this pertaining to this area, so I took great pleasure in reading through his books and the work of his friend Bill Pearson and Joan Metch. And so in our chapter, we've gone back to see what these great scholars and writers actually thought of the era. And it's clear that there's no developed country where social housing or housing that low-income people can afford to live in is built without government subsidies of one way, kind or another. So we cannot get away from the fact that we need public-private, and we would say also community partnership. And there's a very good reason for that, because if you leave the private market to build, the developers are interested in the high end of the market. We were interested in our chapter why Māori and Pacific have a lower proportion of home ownership, given that Māori had a higher level of home ownership than Pākehā at the turn of the 19th century. So we analysed the historical documents and we see recurrent patterns. Sarah spent a lot of time in this library looking at the documents of the medical officers of health, and you'll see some interesting letters here. Our country was admirably, as I remind my students, the first welfare state to recognise Indigenous people as citizens. But there were significant caveats, and my son Harry and his sister, who worked in the Waitangi Tribunal, regaled me on our Friday night dinners with the briefings about in relation to the exceptions that were made about Māori housing. To be allocated a house, even as late as the 1950s, Māori had to live in the manner of Europeans, and preferably in the city. To build a house and to get a mortgage, they needed land needed a unit title. Consequently, twice the proportion of Pākehā now own the house they live in compared to Māori. And moreover, it's compounding because, of course, we're one of the only countries in the OECD that doesn't have a capital gains tax. So our children have inherited money from Bob Chapman and my parents. And so they'll be able to buy a house sooner than Māori children whose parents were not granted a state advances loan in the same way. So they won't have that same lumps capital sum. So different patterns of home ownership lead to inequalities and opportunities. European families have a major asset in their houses in this time of uncertain employment. If you've got a house, you can draw down a mortgage from your house. Māori and Pacific people are much less likely to have buffering wealth in emergencies and more likely to rent a house, from which they are more likely to be discriminated against in the private rental market. We know from surveys, unfortunately, that private rental houses are of poorer quality than state houses, which are of poorer quality than home ownership. When people crowd together into the one heated room to keep warm, they have an increased risk of serious infectious diseases that are a disgrace in New Zealand. And some of you may have seen in the Dominion Post 2 days ago a 4-month-old baby that died in a house because the home was too cold and the parents had to sleep on a mattress in the one room that was warm. Now, actually, the coroner ruled that that was a result of parents misbehaving, in a sense, by having the child sleeping with them in bed. But I would say that the coroner should have reported that this was a case of poor housing causing the death of this child. So to conclude, to reduce the burden of disease from housing in New Zealand and to reduce the inequalities in health caused by poor people having to live in poor housing, and why should they, just because they've got lower income, have to put up with poor housing, we need to improve our housing infrastructure. Spend money on housing, I say, and not roads of significance. It's important that we don't turn our backs on the housing solution that works so well in New Zealand and worked well in other developed countries. Large-scale social housing in mixed communities where it's impossible to distinguish the houses that are owned or rented, whether they're owned by the government or owned by private people. There should be public-private community partnerships, rents at subsidised rates, and houses that can be sold to low-income families, where the government recognise that there's benefits to the whole country if people can own houses. And rental properties in the private and social rental sector need to meet minimum standards to maintain occupants' health. There are many excellent chapters in this book which I can really recommend to you. We're looking for practical, bipartisan policies, which I think we're ready for. I suggest we start with housing.